it's a whole person approach. We just cannot say, okay, you need weight loss, I'm going to put you on GLP-1. No.
Right.
We got to optimize your protein intake. We got to optimize your strength training before I said, yes, let's do the GLP-1.
Welcome again to the Everything GLP-1 podcast. My name is Tom Lavin, and I have the pleasure of having Dr. Neeli Singh here today. She's a quadruple board-certified physician in endocrinology, obesity and lifestyle management, and perimenopausal. And so hopefully I didn't miss anything, but we're really thankful that you're able to come today because we're going to talk about a very important problem. Dr. Singh is working with us at Your Era also, trying to address the obesity problem with GLP-1s from a comprehensive program standpoint. So what I'd like to have you start out at is the perimenopausal female. Most people think of people in their 50s, but it actually starts in the late 30s or early 40s for most ladies.
Yeah.
So tell me, you have some in their late 30s or 40s and they come in and they just say, I don't feel like myself anymore. What do you do?
First of all, thank you for having me here. It's a pleasure being here and talking to you. And you're right. That's my number one consult. I see every day patients coming in, mostly in their late 30s and early 40s. And their main concern is, hey, I don't feel like myself. Something has changed. And I haven't changed my lifestyle. I haven't changed my diet or exercise. And I have gained 15 pounds. And it feels all around my belly. That's the number one complaint. So when I start talking to my patient, first of all, I want to tell them that it's not a willpower problem. It's
Right.
physiology.
Right.
Think of this like a bookend. When you start your life at, when you're 11, 12, the estrogen is rising, and then we get our first period. So that's the puberty starts at the time. Same thing by the end of when you are in 40s, or some patients get it in their late 30s as well, but late 40s or early 40s you will start seeing the most changes. Your estrogen is declining. It's not a very steady process. It's very erratic. It's up and down, up and down. Some months you ovulate twice, some months, many months, you don't ovulate at all. So there is not just declining estrogen, there is also decline in progesterone, which is driving most of the symptoms. We often start by saying, hey, I'm dealing with mood changes and my brain fog, I forget. And I tell you it's real. I mean, I am in that age group. Few days ago, I am at gas station and I forgot my zip code. I had to Google my own zip code where, so I know that I'm going through my changes too.
Right.
And it's normal. It's physiological. It's like we gotta work at everything. So when estrogen declines, it's a metabolic change your body is going through. It's just not hormonal. You are losing muscle. Your insulin resistance is going up. And when insulin resistance is going up, there is also reduced in fatty acid oxidation. We have a bunch of different changes in the body, and all of these kind of tend to make our visceral fat go up. That's the major complaint we have, because everything kind of accumulates around our belly. And visceral fat is not good for us, as you know.
Right.
Visceral fat is not good for us. So we gotta kind of work at the physiology. We gotta work. So it's a whole woman approach, whole person approach. We gotta start with your sleep, which is another thing. One of the first thing to change during this time is your sleep. Patients are telling me I'm not sleeping well. Not sleeping well will raise your cortisol. It will go up. That's one of the stress hormones, and it's just not good for you. Another thing is you're not sleeping. One of the hormones called ghrelin, it goes up. It stimulates your appetite and you are more hungry. And one other hormone, leptin, which is a good hormone, will start going down. So lack of sleep will cause a bunch of problems. So we gotta master our sleep first. That's one of the things. Of course, as you know, we are losing muscle. So we got to work at our protein intake. We got to address that part, nutrition. Nutrition is very important to address at this time. It's always important to address, but especially women going through perimenopause, we got to make sure our protein intake is there every meal.
So many things you have to focus on and
Absolutely.
address. So
Absolutely.
let's take them one at a time, and you and I can talk about them.
Mhm.
Let's start with sleep. Like, what do you do? How do you start to help people improve their sleep? Because I know if I don't get sleep,
Mhm.
I'm not functioning at my optimal level at all.
Correct, correct. So it's a lot of it is also behavioral. So you start by giving yourself a set bedtime. You like I also have given prescriptions to patients saying 10:30 is your bedtime, or you decide based on what your job is, what
Right.
time is your bedtime. Be consistent. That's the key. Be consistent going to bed even if it's weekend. Be consistent going to bed. What we do, even though we are sleeping, let's say 8 hours on average, but some nights you're 6 hours, other days, other nights, you're 11, 12
Right.
hours. That's not helping our system.
Right.
So make sure we have a set routine. Then try not to have caffeine or any caffeinated beverage after 2 or 3 p.m.
Right.
Try to have an early dinner and make your dinner time the highest in protein. That will help you too. And do not eat right very close to bedtime.
Right.
That's not going to help you. If doing all these changes are still not helpful, there is always progesterone, taking supplements, because it is declining progesterone that's also keeping you up at night. So progesterone can help, and certain supplements like magnesium, that's also very helpful. So we can try those too. But after lifestyle changes, if we are unable to address your sleep by making changes in your lifestyle, waking up early in the morning, when you're waking up, go out in sun. Sun is so good for our sleep wake up cycle. It helps your melatonin. So all these things, if try to do that in your daily lifestyle, it will be very helpful.
I've heard recently the term circadian hygiene, as far as getting that early morning light, waking at the same time every day,
Yeah,
going to bed at the same time, trying to get, adequate in bed sleep time so you get enough deep and REM sleep so you wake up rested.
absolutely. Absolutely. Very, very important. So good, you got it. And another thing, like I was saying, chronic lack of sleep, even if you haven't really slept well last 1 week, and you follow these patients and you check their labs after a week of not sleeping well, it mimics like a pre-diabetes picture. Insulin
Wow.
resistance is going up. Lack of sleep will do that to you. Insulin resistance is going up, and the increase in cortisol drives so many things. So, the belly fat, everything. Sleep is your number one thing to fix, and we have to work on it together.
Okay.
Mhm.
What about hormones with these patients? As you were saying, when they're 11 or 12, estrogen goes up,
Yeah.
and now you're in your late 30s or 40s, and your estrogen is going the other direction.
Correct.
Obviously, you check labs and then try to maximize them.
So, very good question. So like I was saying before, when estrogen is declining, it's not a steady process. It's up and down, up and down.
Wow.
So what we are dealing with is perimenopause. Then we have menopause and then postmenopause. So the menopause, think of it as one day in your calendar. We deal with perimenopause all this time. Women stop having their periods, and then exactly 1 year from that time is your menopause. So 1 year of not having your period is menopause. The day after, we are in postmenopause. So the trouble with perimenopause is nothing feels right, nothing is steady. It's the erratic behavior of the estrogen which drives most of our symptoms. So if you checked labs and just relied on the labs, you caught somebody at the peak of their cycle, you will get very high estrogen.
Right.
And you would say, okay, you're not in perimenopause or menopause. That's not true because it's it's going to be abnormal. So you can get lab. I do get labs just to have a baseline. But my treatment will be because of I will listen to your symptoms. If you are somebody dealing with mood fog, joint pain, some of the common thing is plantar fasciitis and frozen shoulder. All of this is because of decline in our estrogen. Estrogen is important for
Wow.
increasing your muscle contractility. So estrogen goes down, and women are saying, "Hey, I can't even open the jar of pickles." So all of this is happening at this time. So let's say our labs are abnormal or normal, but our symptoms are there. That time we can talk about starting you on hormones. So the hormone therapy is estrogen and progesterone. Years ago, when we heard about hormones are not good for us, a bunch of studies came out in early 2000, and we made hormones look like a devil, that you take this and you get cancer, you get blood clot, all of it. Things are so different and so real now, because those days we used oral estrogen, we used synthetic progestins. Those studies, they were done in older patients who had already multiple cardiovascular risks. So if somebody is below 60 or under 60, less than 10 years from menopause, estrogen and progesterone supplements can do wonders for you in many aspects, not just increasing your strength, your maintaining your bones. That's another good thing with the
Yep.
estrogen. Also, multiple cardiovascular benefits too.
That's fantastic.
Yeah.
You mentioned the studies. Obviously, everyone knows the Women's Health Initiative that now appears flawed for those reasons. They were using non the conjugated and the synthetic hormones, not what you use today. And the study was flawed just by the older, sicker patients. What do those studies still carry on? Do people still believe that, or is everyone in the healthcare world put that aside and start treating the patient again?
Thank you. Yeah, exactly. Last couple of years, things have changed big time.
Great.
Also, very recently, FDA took out the black box warning for this. So now and also we use transdermal estrogen and micronized progesterone. They are bioidentical hormones,
Right.
very similar to what our body makes. And the estrogen that we are using, the doses are much less than what we used to get in oral contraceptives or the other estrogen supplements during your reproductive years. The doses are much less just to maintain baseline, so you are not having to deal with this erratic behavior of your estrogen, the up and down. Also, the progesterone is so important because it's going to help you sleep. It also helps with mood changes, and it has a calming effect. It has what we call GABAergic effect. It helps you calm down and relax. So, yeah, I think things have changed, and women are kind of much more aware that there is, help.
There's
That
help. Yeah.
there
And
is
it's
help.
not dangerous like
Correct.
they
And they don't have
previously
to
thought.
suffer through it.
Yep.
And we are just working on your physiology.
So you'll start the estrogen and progesterone on patients that are, in this perimenopausal where they're getting the brain fog and they're not feeling like themselves. Does that change how they feel?
Immediately.
Oh, wow.
Like right after, within a week to 3 weeks, they will tell you, I'm feeling much better. Of
Wow.
course, I start them at lower dose and see
Sure.
them back in a month and then try. So, and then again, try to go up on the dose.
Okay.
But absolutely, they feel day and night difference.
That's
Most of them, I would
fantastic.
say most of them.
Yep.
Some of them, they do have side effect. They feel like they are like gaining some water weight or something for some time, but that stabilizes over a period of time.
And it's kind of funny that you said it can start in the late 30s and early 40s because a lot of people think, I'm good till I'm 50, and that's not the case.
That's not the case. So
Yeah.
if you are not feeling like yourself, you're not imagining things. There is help, and we can do a bunch of things.
Obviously, GLP-1s, if patient, you have to look at everything, but they're, extremely effective, obviously, at helping people lose weight. So GLP-1s and exercise, talk about those two.
So yeah, that's a wonderful question actually. So when they are coming to you saying, I feel weak, I'm gaining a lot of weight, I don't feel like myself. Of course, we are addressing their sleep, we are addressing their exercise. At this age, we gotta do 3 to 4 days of strength exercise, lifting weight. That's key. What my mantra to my patient is 3 to 4 days of weightlifting and daily walks. That just gets you through it. You are like retraining your brain that with this strength training, I can keep my muscle going. The protein intake is there. At the same time, let's say you are still struggling. You have gained a lot of belly fat and don't feel like yourself. We have help. We have the GLP-1s. I believe they are wonderful group of medications. Not because they'll help you lose weight, they work on the physiology. They work at the root cause, which is an increase in your insulin resistance, increase in inflammation. GLP-1s, they reduce inflammation. They help you with multiple cardiovascular benefits. It We worry about, let's say, muscle loss with GLP-1. It's not the GLP-1 doing it, it's us. We are not doing enough strength training. We are not taking enough protein in our diet. So that's why I like to address diet and exercise first. Once we have a set routine and we are doing good, we add GLP-1s. And that does help. Patients do feel wonderful once they have started this and they have lost that extra uncomfortable weight that all sitting around the
That
belly.
central weight,
Mhm.
it I mean, all my perimenopausal females, they get that central weight, and it's kind of the first time they've had it there, and it's
Yes,
so uncomfortable for them.
correct, correct. Even 10, 15 pounds, if you're not used to it, your body is going to feel it.
Right.
And when we are in our reproductive age group, the estrogen, we still have fat, but it goes to healthy places, what I call, tell my patients, it goes to your basement and your garage, like your hips and your thighs. And once we are in that stage when estrogen is
Yeah.
declining, it starts going to the living room, which is the front of your
Yeah.
belly.
Yeah.
So you are right. And that fat is not good for us. It's
Right.
the visceral fat around your organs and which is pushing your belly out. It's just not good for us. So, working to bring that down with your diet, with your exercise, enough protein, and GLP-1 is magical. It's
Yep.
really helpful. We don't have to suffer. We
So
really don't.
T tell me, because you can picture the patient coming in,
Hmm.
and then 6 months later, once you maximize everything, it's gotta be night and day.
Oh, yes, absolutely. They love you. They love you. These medications have made doctors popular because once the patients start losing weight, they feel like it's like they love you for that. So, definitely day and night difference
Yep.
for most of us.
Now, what about because most ladies I find
Hmm.
aren't haven't had a life of weightlifting. So, how do you address that? Because if you ask the average 45-year-old female,
Yeah.
you need to start lifting weights, like, "What?" So, how do you introduce that, and how do you get them to realize the importance of muscle mass and
Yeah.
maintaining
Yeah.
it?
So, that is true. Other day, I had a patient, young, I would say young 42-year-old female, always been a runner, avid runner, and she hasn't changed her exercise routine, hasn't changed anything in her diet, and now she is gaining weight. And she also mentioned something like she's feeling weak, so as if she's losing muscle without changing anything. So, for this age group, multiple studies have shown that we have to lift weight. Resistance training, weight training, 3 to 4 times a week is very important. Just because the decline in estrogen is also it's everywhere, right? It's metabolic. It's working on your in your brain. It reduces something called acetylcholine, which will not let the muscle contract the same way. However, retraining your brain when we are dealing with lack of estrogen by weight and strength training will work immensely. You will start feeling like yourself, but have to do, and there is No magic number. You start slow and you build it up. If you have never done weightlifting, I would say let's start with 3 days a week. Let's go with one muscle group at a time. So upper body one day, next day let's do squats and lunges, and couple days later let's work on your core muscles. And so start slow and slowly build it up. There is no magic number where we start, but we have to do that for this age group.
Oh, yeah.
Mhm.
Now, I need to brag on you a little bit. I didn't know this, but the ladies who went to dinner with said, you've done 700 days in a row of exercising.
I was telling, actually, I also like to brag about it. I go to my boot camp and I love it, not just because I get to exercise. It's the family that you make over there.
Yep,
It's the
yep.
connection. The social connection is another piece.
Yeah.
But yes, lifting weights, it has changed me. I feel stronger than what I felt in my 20s and 30s.
Wow.
And that's why I keep saying, and that's why I can lead by example. I can
Right.
tell my patients, listen, start doing it, find what works for you, and then go for it.
Right.
If I told you suddenly that, hey, go join a gym, probably won't work for you because
Right.
you are a busy mom and taking care of everything. But find your time in your day. The one of the common things I hear, I don't have enough hours in the day.
Right.
But if we started plan your week ahead. So we say 24/7, but we talk about like I'm busy 24/7. But let's just count that in hours. We have almost, I would say, 160 some hours, right? And if we said 8 hours per night of sleep, that's 56 hours. We said, okay, 40 hours of work, that's 96 hours. We still have 70, almost
Right.
70 some hours, right? We can plan our week ahead. We can
Right.
put some time for ourselves, some me time. Whatever works for you, you start. You can start with gentle stretching, yoga, mindfulness, anything that works for you. But do find the time for yourself, because the goal is not to make you or be skinny in our 40s. The goal is to be strong in our 60s. So work that we put in now is going to
Yep.
show up. You will feel it within a month, how strong and confident, and the brain fog also, the exercise, all of this. It does help. So start working on it, start lifting weight, daily walks, get some sun. All of this helps.
That's great. How do you, with all the things that are going to benefit the patient, how do you prioritize them, and how do you, because it can be a little overwhelming,
True.
at
Yeah,
first.
it is. It is. So when I see a woman, it's not like, first of all, it's not one size fits all. We gotta have to individualize.
Right.
Plus, it's not one treatment. It's not just sleep. It's not just mood. It's everything. So what we talk about is like 7 pillars of your care, 7 pillars. So you start with sleep, work on that. There is exercise like we just talked about, enough protein intake, your metabolic health, protein intake, good nutrition, GLP-1 if we need to, your hormonal health. If we have tried everything and we are suffering, there is always help with that, right? Also, I do check some baseline labs. I want to make sure there is no thyroid problem that you are dealing with, because all these issues will resemble what you're going through with menopause. The weight gain, brain fog also can come with your thyroid. Certain vitamins, I do check vitamin B12, vitamin D, ferritin, their iron, just to make sure everything is okay.
Right.
We supplement if it's not there. So your labs are okay. Social, like not communication, but the feeling that we get when we are around good people, not doom scrolling on our phone. The social connection is very important too. Stress reduction, that's another thing, right? Who is not stressed these days? Each and
Right.
every one of us, something or the other. I have a special needs child and I do have worries about him all the time. So we have to work on mindfulness as well. Find your time, morning or evening, whenever you can. What I tell my patients, there is the box breathing or the 4-6-8 breathing. You inhale for 4 counts, you hold for 6 or 7 counts, and then you exhale for 8 counts. So that helps too. working on that. So your stress, your social connections, going out, talking to friends, whatever work for you rather than, doom scrolling on your phone. Change certain habits, avoiding alcohol or cutting back on it, avoiding smoking, that helps. Eating tons of like highly processed food, cutting back on that will help too. So it's a whole person approach. We just cannot say, okay, you need weight loss, I'm going to put you on GLP-1. No,
Right.
we got to optimize your protein intake. We got to optimize your strength training before I said, yes, let's do the GLP-1.
Right. It's such a comprehensive approach, and you have to have that. And the one other thing that I feel is I need a patient to be a partner in their care. Like I
Yes,
try to empower
100%.
all of them.
Yes,
Like I'm going to give you all the tools, but I can't do it by myself. It
yeah,
has to be us in a partnership
you got it.
because my goal is for you to have the most optimized health and function for the rest of your life. But
100%.
I can't force it on you.
Correct. You
We
are
have to
driving
work
the
together.
car. You are
Yeah,
driving the car. I'm just there
exactly.
with you,
Right,
kind of
right.
providing you the tools that you need. 100%. I
Yep,
agree. The patient needs to take onus of their own health.
yep.
You could, I write a prescription for exercise, I write a prescription
I
for
love it.
diet, everything. And you are driving it. That's why I do like to see my patients a little bit more frequently
Mhm.
when I am working on multiple things that we are trying to achieve. And once they are set, it's just wonderful. Women feel empowered,
Right.
feel very different. And I keep telling them it's not a problem of willpower, it's your physiology.
Mhm.
That's what we are trying to address. There is no shame in going on a GLP-1 if our body needs it,
Right.
right? So there is no shame in seeking care if we are not feeling ourselves. We don't have to suffer through our midlife. There is help. We
Right.
can do things.
Yep.
Mm.
No, I love it. That's an amazing approach. And because you're setting the example, working out, living your life, going through the same things, you're speaking from a position of power and like, hey, I'm going through the same things you are, and these are what are
Correct.
helping me.
Correct. Yeah.
I love it. So we talked about the progesterone and estrogen changes in supplementation.
Yeah.
What about testosterone? Because obviously that's another hormone
Yeah.
that can decrease in the perimenopausal time.
Okay. Yeah. Good question. So actually, during this time, as we talked about, the estrogen is declining. The testosterone initially is not really changing, but look at the balance. Estrogen is declining, testosterone is still there. So there is this balance issue. Then women start getting hair around their chin and more hair on their face. So that's one thing. However, further in this journey, when we are postmenopausal, women would also say that I have no sexual desire, low libido. That's one time when testosterone is very helpful, low dose. Unfortunately, in United States, we don't have any approved testosterone for female, any prescription. So it gets very difficult for me to prescribe the testosterone where they clearly benefit from it if it's a low libido problem that they are going through. So uh, I mean, we have to prescribe the male one. I had to tell them do microdosing like this much and then see how it works. But it's very difficult to deal with when we don't have prescription for women.
Right.
There are certain countries where they have approved testosterone, but we don't. We don't. So sometimes we get it compounded testosterone for women if they are
Right.
dealing with low libido, and there is also vaginal dryness that plays into picture. So we can provide them with creams and vaginal estrogen. That's very helpful too.
Okay.
Okay.
All right. And one of the things I wanted to ask you is, and it comes up to me a lot, GLP-1s.
Mhm.
Do I need them forever or do I
Mhm.
just take them for a short period of time? How do you answer that for patients?
Yeah, it does come up often, especially when patients are scared to go on a GLP-1. Their main question is, hey, if I stop it, would I gain all the weight back? So that is a good question. And there is no one size fits all. If you stop it abruptly, yes, most of the weight will come back. But if we have a set routine, we have mastered our diet plan, mastered our exercise, we are doing weightlifting 3, 4 times a week, walking every day, and you feel good at this weight and you want to lower the dose, we can try. Many women are very happy at lower doses. But again, there is think about how GLP-1 work. It works on your physiology. We are dealing with insulin resistance that's going on. It works mostly three ways. It slows your stomach emptying. So food is there longer, so you're not very hungry. It also works on our brain satiety center. So we are full after eating certain amounts, so we are not overeating. Also, it works on our pancreas to kind of manage your sugar control. Um, so it's targeting the physiology. It's like once you're treating the root cause, we want to continue with that. Think about like you are taking your thyroid hormone, right? Your labs normalize. You don't go ahead and stop your thyroid hormone. Your labs normalize because you are taking the thyroid hormone.
Right.
Same thing with diabetes and other chronic problems. You are on these medications for lifelong, for the most part. Obesity or weight gain, if you are somebody who has been dealing with it all your life, it is it requires treating it all life too. It's a chronic problem. However, if you are someone who has always been thin and it's just the perimenopause, then we are looking at short term. Then
Right.
we start you for, and then short term, by that I don't mean couple of months, I do mean few years, to let it kind of go, let it help you get through this perimenopause, menopause, and then we can start reducing the dose. So like I said, it's no one size fits all. I want to make sure that it's working for you. Then we can try lowering the dose and see where you are.
Right. So it's very customized to the patient,
Absolutely.
which,
Absolutely.
yeah, I always say there's no one size fits all.
Mhm.
This is all, me taking care of you, and your DNA and
Absolutely.
everything are completely
Yeah.
different than another patient. So, yeah, so that individualized care is so critical.
Yeah. And there is no shame or harm in staying on it lifelong. I have a disease, I need to treat it. There should be no judgment, first of all, in
Right.
our society if somebody goes on a GLP-1 because they were struggling all their life to lose weight. We
Right.
have to understand that it's it's a disease. Actually a neurological disease. We have two pathways in our brain. One supports weight gain, one supports weight loss, and it depends how we are born. And let's say you and your best friend tried to go on this wonderful diet and exercise journey together. One person has lost a lot of weight, other person hasn't. It's
Right.
not because they fail in doing their things. They followed the same lifestyle. However, they do have a disease which needs treatment. And I would say, bunch of patients and they are on lowest dose of GLP-1. They feel happy, they feel strong, and they feel like they have never been to this weight after they attained puberty.
Right.
So this helps. This is treating your physiology.
Yep.
Stay on it as long as you feel comfortable. It's a good medicine.
I tell everyone, this is evolutionary dysregulation. Think about over the past 1,000 years, the majority of time, there's no food anywhere.
Yeah.
So we've got all these pathways driving, you have to search for energy source because there's none there. So then come to the last 75 years, which is a very short period in our evolution. There's food everywhere, ultra processed food. So
Yeah.
our brain just got scrambled with this dysregulation,
True.
and the GLP-1s just correct all that and, bring you back to where you should be.
Correct. Yeah.
At your era, we're used to looking at obesity and helping with weight reduction first, but realizing it's a comprehensive program,
Absolutely.
meaning we're absolutely going to be looking at hormones, sleep, normalizing sleep, making sure that we have muscle building. So we have a resistance training or
Yeah.
weightlifting program with adequate protein intake. And all of these things are very important. Plus, looking for any bad habits. I mean, some people, I was talking to one patient, this is a while ago, and she's like, well, I drink a lot of tequila. I'm thinking, that's an unusual statement, but
Mm-hmm.
what is a lot? She goes, 10 shots a day.
Wow.
And I'm like, what?
Huh.
I had, so, the excess alcohol, smoking cigarettes,
Mm-hmm.
any kind of, drug addiction. So looking at those habits, and trying to help with those habits on the GLP-1 front, interestingly, it was a diabetes drug, and then it was, right now it's the drug that treats obesity, but there's so many cardioprotective
Absolutely.
effects and inflammation
Yeah.
effects where it promotes mitochondrial health and
Mm-hmm.
promotes endothelial health in the heart and manages the immune system to downregulate all the inflammation and free oxygen radicals it decreases. So there's so many benefits of it to decrease cardiac disease and really all chronic disease
Correct.
that it's a
Correct.
um, uh, good therapy for people long term. Now, all these studies on these other pathways, including addiction, dropping the dopamine spikes on the cues.
Yeah.
So all of these other pathways are more biomarkers and animal models. So obviously, we'll see long term in studies, but the peptides are very safe, and patients I find enjoy taking them because they feel so good.
Mm-hmm.
Um,
Yeah. Our goal is not just to have our women or our males or anybody just to lose weight. It's to work on your energy, your mental clarity, your strength to kind of build you up for success. Again, it's not, we don't want you to be like a skinny 40-year-old person. We want you
right.
to be a strong 60, 70-year-old woman. So that's our goal. And I'm so glad you're working at this comprehensive approach.
Yeah, couldn't imagine doing it any other way. And that's just kind of how we've taken care of patients our entire lives.
It's
So
wonderful.
it's a
It's
way
wonderful.
to do it.
Good.
Um, Anything else you'd like to add? Because, what you're doing is so valuable and patients, like I said, I mean, there are so many patients in the 30s, early 40s that don't even think they could possibly be in the perimenopausal time, but they are,
Yeah.
and they need your help.
Correct. So I would say if you are not feeling like yourself, if you think things are different and changing, don't wait. It's your physiology, it's not your willpower. We can work on it. And we do look at everything. We work on your sleep, lifestyle, your memory, mood, all of it. All of it is factored in. We will help with medicines where we can, but we start with your lifestyle changes. And it's not one size fits all. So you do work with your physician to get where you want to be. You don't have to suffer.
Absolutely. And talk about endoharmony.
So thank you for that. So I have started my own clinic. I'm CEO and founder of EndoHarmony, which is a comprehensive endocrine clinic. So, with my background in endocrinology, obesity, and lifestyle medicine, and now I'm also a Menopause Society certified physician, my work sits at intersection of women health, their general well-being to kind of make them ready for the changes that's coming in this midlife. So midlife is also a good, happy, healthy journey to get us where we want it to be.
Right. That you just need to address the biology
Absolutely.
and
Yeah.
support because, midlife should be a great time. You've worked your
Absolutely.
whole life
Yeah.
to get there.
You worked your
So
whole life to get there.
exactly.
Yeah.
So, well, we appreciate you coming all the way from
Thank you.
Boston, and we appreciate everyone tuning in today. And we look forward to seeing you on the Everything GLP-1 podcast next week. And once again, as we always say, this is no substitute for proper medical care. We're not giving medical advice. We're just trying to provide value in the space of health and wellness and optimizing your weight and function at any point in your life.